My name is Allison, and the topic I'm going to be talking about is diabetes and eating out. I currently work for Sutter Gould Medical Foundation Community Health and Education Department. I'm an RD and also I'm a CDE. I'm a certified diabetes care and educational specialist. So before we get started, we felt like this topic was really timely because we found out that 3 out of 5 Americans say they eat out to dinner at least once a week. And for someone with diabetes, this can be very challenging. So our tips are just to give you some tips on how to make that transition work for you. So the first thing is you'd want to plan ahead. So you would look up menu online in time so you don't feel rushed or tempted by making healthy food choices. Nowadays, most menus are posted online, so this is an easy option. But also you want to know how much carbohydrates you should have at that meal. So many restaurants have nutritional information available for you. Either it's posted online or when you get to the restaurant, sometimes it's posted on the boards, the billboards or the menus. Also, another tip is maybe you might want to eat a light meal if you had a big lunch that day, or if you know ahead of time what you're going to eat at a restaurant, you may want to plan lighter meals throughout the day. Another tip is thinking about your portion sizes. Now, at most restaurants, usually serve food that's enough to fill 1 or 2 people. So the easiest tip that would help somebody out is if you ask for your restaurant is to find out what the portion size is and maybe ask for a half portion or lunch portion. And a lot of times what I used to do is if I'd go to a restaurant, sometimes I would just ask the waiter to pack the second half of the portion size in a to-go container. That way it ensured that I didn't overeat during that meal. Sometimes if you see your plate and it looks too big, you want to eat everything that's on there. So by just either asking for a smaller plate or just asking for the server to pack your rest of your meal to go is always an option. Also, you want to stick to the diabetes plate method. So with the diabetes plate method that we have posted here on the side, you just want to remember to fill half of your plate with non-starchy vegetables, 1/4 of your plate with the lean protein, and then the rest with carbohydrates. And then you want to visualize what your plate would look like at home and try to apply the same knowledge to a restaurant meal. Restaurants typically have huge portions compared to portions at home. So that's where the smaller plate may come into play. And then you want to remember that one entree can be 3 to 4 serving sizes. So again, splitting it in half, maybe sharing it with another person is another way of reducing the portion sizes and calories when you go out to eat. Now, another tip is to order wisely. So, appetizers can be full of a lot of fat, calories, and carbohydrates. So, probably the easiest way to cut calories and to cut carbohydrates is to skip the appetizers, especially if weight loss is a goal for you. And don't forget about the foods, like for instance, when you go to a restaurant and they have tortilla chips, maybe you may want to ask them to skip the tortilla chips with the salsa. If you're going to a restaurant and they have bread, to make sure you take the bread off the table so that way you're not tempted to eat extra carbohydrates and calories. Another tip is to substitute fresh fruit or vegetables for high-fat side dishes. I know a lot of times when you go to some restaurants, they always usually have some kind of vegetable stick or dip available. And then you want to focus on what healthy items you can add to your plate instead of only wet foods to avoid. So look for things like whole wheat grain breads, pasta sides. Look for foods that have healthy fats such as olive oil, avocados, nuts, and seeds. Anytime you can substitute something you would normally eat with cheese with avocado, that's always good. Something you would normally substitute with chips with nuts or some kind of crunchy vegetable would also be healthy. Also ordering lots of fruits and vegetables, and then go for lean meat, turkey, chicken, and fish. And then look for words such as grilled, broiled, or steamed, meaning that the food is cooked with less fat, and avoid dishes that have descriptions such as fried, breaded, smothered, Alfredo, rich, and creamy. And usually that is a way of avoiding extra saturated fat and calories. You also want to share and savor. And share and savor means you may want to share your meal with a dining partner, place part of the meal in a to take home container at the start of the meal. Enjoy an occasional sweet treat, minus the guilt, by cutting back on carbs during the meal and get the dessert to share with the table. I've done that a lot, where if you have a dessert, maybe you can share it with the person that's with you, so that way you're reducing calories. And then you don't want to miss out. Usually when you eat, I don't know about you, but usually when you eat, usually the first few bites are really the tastiest. So sometimes just getting a bite of the food and just savoring the taste of the food is enough to help you out with feeling satisfied. So if you have any more questions, just know that we're here to help. So ask your diabetes educator for more tips for eating out. And if you have one, ask your doctor for a referral for a diabetes educator or program. And then you can reach out to us at our community health education. We also have a no cost resources here at the Menino Community Health Library for more tips. And then just call, emails, and just visit our website. And just remember that we're open to the community, and our number is listed below, which is 209-523-0732. And we have our website if you have any questions. Just remember, always speak up and let your server know about healthy preferences and options. And then have a great time dining out. Dining is supposed to be an enjoyable experience. So we want you to feel empowered and at the same time still love the joy of eating. Thank you.